Okay, it's working now. Hi,
Yay!
how are
How
you?
are you?
Good, how are you?
Good. Thank you so much for joining us this
Yeah.
evening.
All right. My
Yay!
pleasure.
I'm so excited to talk about everything OT.
Yes, me too. So,
Excellent. So tell us a little bit about your background and how you became a pediatric OT.
so I've been a pediatric occupational therapist for the past like 15 years. I've always worked with children, always had a desire to work with kids with disabilities. Kind of did a lot of babysitting, worked as like a parapro with special needs children with autism, cerebral palsy, and a bunch of like genetic conditions when I was in
Mhm.
college. And just kind of knew I wanted to be an occupational therapist. My mom kind of encouraged me to go into it because she always wanted to be an OT. She was a teacher, so yeah. So just kind of
Awesome.
always had a
And so for
passion.
anybody who doesn't know, do you mind explaining what an occupational therapist is, especially a pediatric occupational therapist?
Yeah. So a lot of people have no clue what we do. Pediatrics is a whole different ballgame. An occupational therapist in pediatrics, we work a lot with all sorts of different populations, different ages. We'll work with kids with brain injuries, traumatic, like spinal cord injuries, multi-level surgeries, those types of things. And we also work with kids with developmental issues, cerebral palsy, and sensory processing disorder, which you'll see a lot with kids with autism. And just general children in general with like ADHD or kids that have some coordination issues. Our claim to fame is kind of our fine motor coordination, but there's so much more to what we do. We also address vision, visual motor and perceptual
I
skills,
That's a
and
big one. I didn't
so many
know.
other
Yeah.
things. So,
Yeah. And what is sensory processing for our little one? So what is that?
so sensory processing is kind of how we process all the different senses, and then as a child develops, how they're taking in and developing their vision and their proprioceptive system, so kind of telling us where we are in space, those types of things. They're processing noise, they're processing light. So we're processing all these kind of sensory things in our
Like our
environment.
environment. Yeah.
Yeah. Um,
Yeah.
so a lot of kids have difficulty with processing that, and you'll see them have a lot of meltdowns. You'll see kids just have motor functioning issues because they can't process all of it. Um, and you'll have to see kids kind of have issues with upgrading their diet, or they'll be kind of really picky eaters
Hmm.
because they can't tolerate kind of different tactile stuff in their mouth and those types of things. So.
Wow. Yeah. And so for parents at home, what are some like general, I know there's a lot that plays into requiring occupational therapy, but like what are some general things parents should be on the lookout for, even for babies, as far as like maybe this is something we should look into with our pediatrician and get an evaluation? Like what are some red flags, I would say?
So I would say too, a lot of times when your kid is developing, if you're not seeing development, so if you're seeing your kid just really not progressing, um, they just kind of lay around, they don't move a lot, maybe they're just really difficult to calm, so they're constantly crying, you can't really calm them down, or you're just not seeing them advance with motor skill. So like, for instance, if your kid's sitting, so you're like, oh, they're sitting by 6 months, which is pretty age appropriate, but you don't see them progress to start to turn their body a little bit, or you don't see them go into 4 point, or which will kind of advance into that crawling system. Um, I think that's like a big piece right there where parents should kind of be like, oh, okay, like, why isn't my child kind of advancing? They're just content with sitting there. Or if you see, like, what I see a lot too is like kids will have asymmetry with their movements. So kids will maybe sometimes crawl or butt scoot to one side
Oh, wow.
more so than the other. Or
Yeah.
maybe they have like a lot of times we see kids with torticollis at a young age
My
where
daughter
they
had
have,
that.
yeah,
She was a really big baby and she got stuck in my pelvis, and so she came
yeah.
out with torticollis. But yeah, I mean that's how I know about OT, is that from birth we were in OT.
Yep. Yep. So yeah, and that's a big thing too. So a lot of kids will have kind of like when they're first born, you'll see them kind of just all like a lot of times you can see in pictures, they're only looking to one
Yeah.
side. And then you don't see them kind of always ever go to that other side. That's like a huge red flag that they probably can't get to the other side. And that is such a huge piece for so many developmental skills, including, just the visual motor development, and just kind of using that other side. So a lot of times those kids will develop their vision to one side and they forget that they really don't learn that they have a left side, so
Yes.
that's a huge
And we have a follower right now saying that their little one is very happy sitting doing nothing and it drives them crazy.
Oh, yeah.
So do you have any pointers or something you can suggest that they could possibly do?
Yeah, so a big thing I think in pediatrics is you have to find what is motivating. That is a big thing. I have a lot of interns and I always say, you have to find what's motivating for the child. So if you get out like some bells and they hate bells and you're trying to get them to move to get the bells, they're probably never going to move to get the bells, right? If they're kind of a content, happy sitter. So I would kind of find something that's motivating for them and just maybe put it a little bit outside of their reach. So if they're just content sitting, maybe put it over to the side where they have to just start turning, and then kind of once they start doing those types of things, then you move it a little bit further. I think that's a big piece. If they're having difficulty getting there, then I honestly would probably suggest that maybe possibly do kind of a evaluation. Doesn't hurt to get an evaluation. So
it never hurts to get an evaluation and know like, okay, my child needs a little bit of assistance or we're on mark. Mm-hmm. Yeah, I have a lot of mom friends with babies and they're like, oh, they'll get there or, it'll be all right. And then you see later on, they're not getting there. And that's when occupational therapy steps in and they assist your little one to get up to speed.
Mm-hmm. Yeah.
So what are some tools that you would use with for a baby? I know rolling is a big piece of it. Something I learned is that a baby, when they roll, they should corkscrew. Am I right? And not log roll?
Yeah. Yep. Yeah. So
I didn't know that.
Yeah. So when your babies are rolling, they kind of, they'll kind of do like a rolling pattern, but they kind of bring their arm forward and bring their leg up and over. Mm-hmm. Yeah. Mm-hmm. So they kind of break apart. We call it can they kind of disassociate their movement patterns to kind of roll their whole body. And then you'll see their head kind of lift up. So we call that kind of the head writing.
Which is these are all things that as a new parent, you don't really know these things.
Yes.
So that's why, anything we can get from you as far as what are some flags we should look for, under the age of 1, your child really should be hitting their markers that your pediatrician gives you. And if they're not, and you're concerned about it, or like you said, they're only turning to one side, then it's time to kind of reach out to your pediatrician and bring it up. Correct?
Yes, correct.
Yeah. And starting solids, that's another piece of it as well, right?
Mm-hmm.
Yeah. Starting solids. Go ahead.
Yeah. So a lot of times too, when you I always tell parents too, though, if your kid isn't, a lot of times they'll say okay, start kind of the puffs or kind of those salad type foods, easily dissolvable foods. Typically your kid needs to be sitting before you do that. And you'll see that on the containers. And there's a big reason for that. So if your child doesn't have good core control or they aren't able to sit, typically their tongue doesn't have the good ability to move side to side to manage those types of foods. Because at first your tongue needs to develop that stability too before it can kind of work on that movement pattern side to side. So you kind of see that the same with movement when a child is sitting upright, when they start to turn and move, and we call that more dynamic sitting movement patterns, you'll start to see that there's that correlation even with the tongue, which is
that's incredible. Cool. I did not know that. That's amazing.
Yeah.
Wow. So. And so for traveling, I mean, it's like sensory overload. So what are some tips you can give parents, because toddlers are going to have tantrums, babies are going to cry. Is there anything that parents can do to prepare or assist them, like the noise canceling headphones, baby wearing, or is there anything else you can recommend that would help toddlers, parents survive traveling with little ones?
Yeah, I think traveling is trying to keep a routine or a consistent routine with them when you are traveling, if you can. I know sometimes that's a big barrier. I know I've traveled a lot with my kids in an airplane, and just kind of prepping them for, toddlers, sometimes they don't have the abstract reasoning yet. So it's just kind of like, oh, we're going to go on a fun ride, and then maybe prepare them with like a transition tool or a calming tool that, works with them. So you could kind of pack that into their backpack, and then tons of fun activities that they can do with their hands. And I would say that cause and effect thing lasts for about 2 minutes, because kids are more into like, how do things work? This is fun. So even you could get like Cheerios or something and put them on a pipe cleaner and let them pull them off, and they can eat that as a snack. And then they can kind of, let's put them back on there. So you're kind of engaging some activity there too. And then it also works on their motor skills as well.
Yeah. Yeah. And so like in being an OT, you work on fine motor, large motor. And so what are some things that parents should look out for, like small motor? Like what should your child be able to do at what marker? And if they're not, like that's something where you're like, oh, yep, we should probably look into that. Or gross motor, what is all of this?
Yeah, I think with fine motor, a lot of times kids develop like a pincer grasp, which is just these two little tiny fingers pretty early. Like I would say, like around, like if they don't have that by like 10 to 12 months, I would be a little bit more concerned. There's a lot of kids that will just be called like raking gross grasp. So they'll kind of grab at things like this. If they're still doing that at that age, I would probably be like, we need to kind of look at that a little bit more, because they should be able to have a little bit more of that fine control. I also tell parents too, if your kid never does fine motor, like hates it, like you have the child that runs around the room and never uses their hands, kids, we learn what we practice. So if your kid isn't you have some kids that have amazing fine motor skills and have terrible gross motor skills, because they like to just sit, they're more sedentary, and they'll sit and, color or do little tiny fine movements and stuff like that. So I would say that's a huge thing too. Or if you're noticing when they go to reach for little things, they're really having difficulty targeting or grasping it. You always see them kind of, we call it over and undershooting. Sometimes that can be a visual component to it as well, or just a body awareness of knowing where we are in space. And that can affect that fine motor skill as well.
There's so much with these little ones, because they're growing and developing so quickly in the first year, but you really have to pay attention to what they're doing and knowing your age markers as far as, are they hitting that, or are like they're a year and they're not able to pick up a Cheerio or something like that. So walking is another piece of it, and so that's huge when your little one can walk. And not crawling is another thing that little ones sometimes don't do. They skip that step. So if you're seeing your little one not crawling and then struggling with walking, like that's a marker, right?
Yes. And I think the crawling, my older son did not crawl. He but scooted to one side. And I will tell you, like what I will see, and I see that with him too, is a lot of those kids have trouble with body awareness. So they'll appear very clumsy. Sometimes they have, they run into things. They don't know how to gauge pressure. They might grab something too hard or too soft, they drop things a lot. So they do, like when you crawl, you get so much, we call it proprioceptive input through the hands. And you get a lot of upper body strengthening. You get a lot of core strengthening. So the kids that don't crawl don't get that. So they tend to lack that body awareness. They tend to have difficulty more with like crossing midline and bilateral integration skills, which carries over into tying shoes, doing buttons, kind of anything that you have to use two hands together. So you'll see a lot of that, or the visual motor integration. So kind of using your eyes and your hands together and those types of things. So you'll see that struggle as they get older. So I think the big thing before was, oh, it's okay if your kid doesn't crawl. And actually the CDC is not recommending which is so frustrating, I think, as a therapist, because I have my own child who I see struggle with certain things because of the lack of crawling. And I've done a lot of intervention with him. But so I think to me, I always encourage parents, like, get your kids crawling, even if they can't. if your kid has cerebral palsy, and a lot of those kids will not crawl because they have so many movement issues and there's so much more to that.
Right.
Then we look at different sources of a way to develop that in a different way. And that's, a lot of those kids get intervention at an early age. So,
Right.
and I say the earlier, the better, because the brain is plastic. So we know we're now seeing too, like, I know we're at the hospital that I work at, our physicians go into the NICU even, and they do assessments on these kids in the NICU. And if they're seeing some neurological issues early on, they start intervention, and we're seeing that these kids are developing a lot better now, which is super cool. They say it's kind of like reversing really cool. What's that?
That is really cool.
Yeah, it's super cool. But and I work with majority of kids with neurological issues, and you see such a change. Like the more we can get them to do a motor pattern over and over again, that's how the brain learns, right? So
right.
If we can catch this stuff really early on instead of doing the waiting game. And I think we're pushed to do the waiting game now. We're like, oh, well, it's okay. I had that with my own child, and I saw red flags. Luckily, I knew what to do with him. But, the doctors are like, oh, they're fine. They're good they'll be just fine. And it's probably true. But if you can help them and get them started early, they'll have stuff down the road as their motor skills advance will become easier for them, so.
Yes, 100%, because you don't want to have the child in first grade who's struggling cutting because of gross or fine motor skills that could have been worked on, and then they could have been up to speed. So really, I think it's just being super fine-tuned into your kids' development. And if your child really, you see them struggling or they're favoring something, just get it checked out. Talk to your pediatrician. And then there are therapists like you that are here to help other little ones grow and develop and catch up to speed if they're lacking ability, or like torticollis, for example. That's something that they're born with, and then you go to therapy and all of a sudden they're fine.
yeah
It's amazing. And early intervention, especially with babies, I have to say, my daughter, she needed a helmet, and my pediatrician was like, just wait it out, it'll be fine. And just my mom intuition was like, I'm just gonna go get the evaluation. And she was just 4 months, and they put her in the helmet because they were like, let's just do it. And she was in the helmet for 3 weeks, and they said that if I had waited for my pediatrician to give the approval, it would have been 16 weeks.
Yes, we see a lot of kids.
Wow.
Yeah, I don't do as much torticollis anymore, but I did initially when I first started my career, and it's crazy how, or kids that don't get any intervention until I worked with a child. I remember he was like 1 before he had any intervention. And so he was walking. Everything was like one-sided, and it was just so challenging. And his neck was so significantly tight. And you saw that affect, his eye-hand coordination. And he was so far behind his peers by that time, And a lot of these kids, we'll get them in our clinic pretty early, maybe 2-3 months if they catch it, if it's something that developed, when they're in utero. Or, you'll get the kids that just have that preference because they maybe have some weakness. So then they kind of just turn their head and stabilize there. Sometimes those kids end up having some other neurological things going on as well. So if we can kind of get them early and fix the torticollis, and then we're still seeing some other neurological symptoms or signs, we can at least kind of contact the physician and stuff and say, we're kind of noticing some weakness on this one side, and and so on. So
so when you go for your pediatrician like checkups for your little one, you have to go for those markers. Just make sure that they're running through the milestones and you're double checking and not playing the waiting game, because if they're not hitting it, just don't wait it out, because it's only going to get harder, especially with the tantrums too, and that's part of the therapy as well, is that, it's going to be harder because they're going to be smarter and they're going to be older, and it's going to be more difficult opposed to when they're younger, and you just catch it and you work on it quickly. Right.
Yeah. And if you can catch, I think a lot of the tantrums that you're probably talking about are related to the sensory processing kind of disorder stuff. The kids have that sensitivity. And a lot of times if your child is continuously dysregulated, like they are constantly whining, they're constantly crying, they're constantly having meltdowns, that is not normal. I always say kids, we do have kids that like come from like trauma situations. Like I see a lot of things that are pretty bad, like that makes sense. You know, they've been exposed to trauma, whatever. But if you have you're kind of providing the basic needs for your child, there's really nothing there. And that's constantly happening. They might have difficulty processing noise or light, and they're constantly in that fight or flight stage. You'll see kids like that, where they just walk around and they're just like, and then a little noise goes off and they just melt down for an hour and you can't get them back. And that's the difference too between distinguishing, is it a sensory issue or is it a behavioral? Because yes, we have behaviors, but typically you'll have a behavioral meltdown that will last 10, at the most 15 minutes. And typically you can kind of decrease that by doing some behavioral management stuff, right? It's more those kids that they just cannot recover and you have to kind of intervene. And then you become stressed out. So then you're in this fight or flight, your child's in the fight or flight. So it's amazing if you do find a good OT that really understands your child and can teach you, hey, this is why your child's doing this. Let's try some of this intervention. I've seen so many parents and kids, like their life has improved significantly because of that, because it's like, oh, okay, I understand my kid now. Because a lot of times we just yell at them and it's like you're shaming them for how their body's working, you know? So
yeah, I can imagine you're like stressed out, feeling stressed out, and then having someone not understanding, just yelling at you for feeling the feels.
Yeah. Yeah. And a lot of parents will say, I don't know what to do. Like, I've tried this and I tried that and nothing works. Because like your child's already in, like, it's almost like I always equate it to like a panic attack. Like your child's so overloaded by this time, that meltdown is just like an extreme reaction. And there is no coming back
level.
Yeah, they just have to get through it. So if we can
just ride the wave.
Yeah. And there's a lot of cool techniques out there. We do, there's called the Wilberger protocol. It's like a brushing program that you do throughout the day. You know, a lot of times we'll do bear hug vests. It's kind of like a tight compression vest that's very calming and organizing. We did blankets or just activities. So we kind of find how different sensory systems work. And some are very calming to children. So we'll provide activities like that throughout the day. We call it like a sensory diet. And then the child throughout the day is getting like these doses of things that keep their system more regulated and feeling well. You know, because a lot of times that's so impactful. Or you can kind of sense your kids ramping up. And, you know, your therapist might have said, oh, okay, we know that this works, whatever. So you do that intervention and then you avoid that meltdown. You know.
And what are your thoughts on like toddler yoga for like when you just need to like help regulate your little one?
Mm-hmm. I think it's great. I think yoga's good for everybody.
It's so cute. I've seen it on YouTube and like every version. Like if you're a little one, like my son loves Thomas, and during the pandemic we would do Thomas the Choo Choo Train yoga, and it was great. But just curious what your thoughts were on toddler yoga.
I think it's good because it gives kids tools. I know my son just turned 6. I know they must do it at school because I catch him doing this all the time in his little, but I think yoga is great because it does have that calming effect to them. It slows them down. And it also kind of provides that extra benefit of kind of body awareness, which is wonderful. And I think if we can give kids tools at a young age, I use this program called like Zones of Regulation, and we start that pretty young, where kids identify with a color of like how they're feeling and their emotions. And then you have a toolbox. So depending on the age, you can have a fidget toolbox or different pictures of things that's helpful. And they start to learn, oh, when I do this, it makes me feel like I'm getting back to my green zone. So it's kind of a cool thing that you can start at a young age too. So I think baby yoga is wonderful. Or toddler yoga. So it kind of gives them and I think when they feel that calm, they probably might seek that out too,
Right. Yeah. So like if your little one, your C is like maybe dysregulated and you're having tantrums, just as like a little Band-Aid, maybe try some yoga before you seek help. But like you said, if tantrums are going on for an hour or you're having them continuously, definitely time to reach out because that's not normal.
Yeah.
I mean, kids tantrum, but
Yeah. And I
There's
think a
always
lot
a
of times
reason.
what I see is like it's surrounding mealtime or bath time. That's a big thing. That's your tactile system, your oral motor system, that a lot of kids have sensitivities with that, you know.
Oh,
And,
wow.
and so I think bathing, I have a few kids right now too that, you know, and then the thing is the parents are, well, I have to bathe them. So they put them back in that really adversive environment and you're creating this like, in the, you know, it's almost like that anxiety reaction, like just exasperates every time because the child's really not ready for all that input and it just sets them over the edge. So that's kind of, you know, a big thing too, that if your child's having that extreme reaction during those times, like consulting with an OT or getting an eval would probably be really beneficial. So
Yes. And as a parent, I think what you touched on was huge, is like staying calm. Like, even
yeah,
though it can be extremely stressful or anxiety driven, like just be the calm through the storm to help them
yeah,
through it.
yes, for sure.
Yeah.
Yeah, because the
Even though
stronger
bath
you
time
react.
should be relaxing.
Yeah, and I think that's then parents are like, oh, what else can I do? You know,
It's like, do
and
nothing.
yeah, and that's the thing too. A lot of times, if you give the child control of part of that, and you do it outside, so a lot of times this child's a lot of times by the time they come to therapy, it's like we've had trouble for like a year, you know. So a lot of times, what I'll do is I'll have the child like when you go in the bathroom, even if they want to, don't make them go in the bathroom. You know, you can do bathing outside of that, and maybe just get a small little water tub and put
Mhm.
soap and fun toys in it and let them play with it and let them control it. So they're getting all that stimulus, but you're letting them have control and it's a positive experience. Then you can kind of continually add, you know, a bigger tub. And a lot of times you'll see, I've had a couple because they just like take the thing, they like dump it on their head and their parents like, they're going to freak out. And I was like, no, they're doing it. And
Because they're
it's
in
fun because
control.
they're controlling it.
Yeah.
Because I think there's a lot of things that you'll see kids that they do have some sensitivities. You have to allow them at some point to control some component of that and have a positive experience in order for that to kind of desensitize them a little bit.
Right.
There's times where we do provide that, but you got to find that just right providing to expose them, but not have that extreme reaction all the time. Because then you're just going to
Right.
exasperate the anxiety. So,
Yeah, and it's not like the old school mentality as kind of we grew up, where it's just push them through, it'll be fine. Because
mhm.
they won't be fine if you just keep
No,
pushing them.
yeah.
Exactly. We just had a comment saying it builds confidence, which is exactly right. It does.
Oh yeah, for sure it
I
does.
love
Yeah, it's
that.
kind of like, oh, I can do this, and I think it gives our kids tools too to say when something is scary to me, I know that yeah, you kind of, I I myself can kind of control like what I'm doing and kind of overcome something, right? So like it's kind of a cool thing. I think when I was raised, it was like you just do it. Like I don't think we
Yeah,
had like
same. Yeah. You don't have a
yeah,
choice. You just do
like
it. And if you're scared
just
of it, you just keep doing
yeah. Where that's why like I always had to drink hated milk, you know, my mom made me drink milk and it was warm every time. Still hate milk because it was
it.
like
Yep.
negative every time I
Me
did
too.
it.
Me too. It was
So I was
milk for
like, you know,
everything. And I'm like, I hate milk now.
yeah, I was like too many aversive times with that. So
Yeah, except my kids like chug milk. And I'm like, oh, how can you
oh yeah, my
drink that?
it's disgusting. Right?
Yeah,
So,
yeah, but I think being the support system and being creative, I think that is a huge marker
mhm,
as well. If you see that your child is struggling with something, kind
yeah.
of get creative with it and be
Mhm,
supportive and keep trying on it. But if they're not getting there and you're not getting traction with what you're doing, then it's time to reach out for help,
mhm.
because you guys are amazing. You come up with amazing ways to teach our little ones things that shouldn't be scary to be something that they love, which is incredible.
Yeah, yeah. So well, thanks.
Yeah. So is there anything else you want to touch on? I know we've touched on everything that I can think of that parents should know about occupational therapy with pediatrics.
Mhm. I think, you know, maybe one other thing that I think a lot of people don't know OTs do is the vision. So I always
Yes.
say to, sometimes we'll have kids come and they're like, oh, they're having trouble reading. Um, and they can't figure out why the child has trouble reading. There's a lot of kids out there that we know have difficulty with like tracking, or they skip lines, they skip words. So what really happens is it's a visual motor issue where their eyes are having difficulty moving across the page. So they're working so hard to read those words that their brain isn't really retaining what they're reading, if that makes sense. So
Yeah.
I always say too, when I have some friends say, oh, my kid's having difficulty with reading. They're like a reading intervention and they're not making much progress. That would be like, that's another red flag to say, well, you know what, maybe have them get screened by an OT that specializes in vision. And a lot of times we'll see that, yeah, kids are they're really having difficulty with this. And we have a lot of interventions and they're pretty fun. And you'll see kids kind of improve on their reading skills because it was really just a motor issue. It wasn't really like a cognitive issue, you know. So
Wow. And it's not always just vision. Like you need glasses. It's motor skills.
yeah.
And we had a comment asking how you stay calm through this process. Someone would like to know how you stay calm through this process.
Oh, well, I mean, with my own children. So, you mean just like working with the sensory children, or just in general? Oh, how you would as a parent?
Yeah, someone commented
Yes.
how you stay. No,
Good question. Yeah, because a lot of times by the time you seek help, you're already at your wit's end. And I think as a parent, I have a child that has some sensory stuff too. And there's some times where you just are having a day and you're like, oh, I just can't, I don't have the patience for this. So I always say, when you're going to, I guess if it's like a thing like, oh, I have to bathe my child today, maybe don't do it on those like crazy stressful days. Or just take a break. And if your child is having a tantrum and you realize you really don't have, you yourself need a break, then you go take a break and let them have that tantrum until you feel calm enough to kind of readdress it. What I see a lot though is when parents start to understand their child and why they do what they do, and they start to do interventions to almost prevent those tantrum meltdowns, I see a huge shift in that dynamic. And then the parents are a lot calmer because they come in, like a lot of times we panic because we don't know what to do and how to help them.
Right,
you know?
right.
I
mean, I think it's natural response too, because it's like frustrating. And, you know, we just had a comment as well saying that they have to repeat everything over and over for their little one, and it's extremely frustrating. So is there something that you could recommend, or maybe they should seek help? What would you do for that?
So if you have to repeat like directions, is that kind of?
She just said they have to repeat. My son is so sweet, but we legit have to repeat things to him over and over again.
Oh, okay. So he might not be processing. Oh, almost 10-year-old. Yeah. Okay. So that might be an auditory processing issue. Or a multisensory processing. So sometimes kids, if you give them like a 3-step direction, what I maybe say, oh, I need you to go brush your teeth, get your pajamas on and go to bed. And then the child's not doing it. You keep repeating it, keep repeating it. A lot of times go and ask your child, what did I ask you to do? And a lot of times some of those kids, if it's an auditory processing issue, they'll say, well, you told me to go brush my teeth. And it's not like they're not hearing all those steps. So then maybe give them 1 step at a time and see if that helps. Or sometimes if it's a routine thing, doing a visual schedule, sometimes kids do really good with that. You know, because, you know, kids with like ADHD or just the auditory processing stuff, sometimes that's where you'll see that. And you're like, oh, and then they start to get in trouble for it. And they're not intentionally trying not to listen to you. Or tell them in a quiet environment, because some kids have trouble if you're in a noisy environment, and if they are having trouble processing, you know, the vision and the noise and everything, and then you add a 3-step direction, it's just too much overload for the brain, so they don't really hear what you're saying.
Tantrum.
Yeah. And then it's like, oh, I don't know what you want me to do, you know.
And then everybody's frustrated because you're like, I've asked you to do something.
Yeah.
And they're like, I can't because I'm so overloaded. Yeah. So that's like the perfect storm for a meltdown.
Yes, for sure. So.
Yes. Sorry, I wanted to address that, but let's jump back to the vision, because I was fascinated by all of this. As far as like with the vision, I always just as a parent would assume glasses, but what you're saying was amazing. It could be OT needed.
Yeah. So a lot of times, and people don't understand, because a lot of times I'll ask parents, how do you feel like, feel like they have any vision issues? Oh, they went to the eye doctor. The eye doctor said they're fine. So what OTs look at is we look at scanning. So your ability to scan in the environment and look for something. We look at convergence. So kind of like if a ball's coming at you and your eyes aren't coming together, that ball's probably going to hit you in the face, right? So a lot of kids will have, we call it convergence insufficiency.
Mm-hmm.
Or they have perceptual issues where they can't locate something. So they have I always use this as like a busy sock drawer and you have to find a pair of socks in there. And that's so much overload that they can't figure out, oh, you have to find the pair of red socks. And that's just like too much for their brain to process. So there's visual, motor, and perceptual skills that kids will struggle with, and we see that a lot developmentally in our clinic as well. So if your kid is struggling
would you start to see this? Like what age bracket would you say you're like, okay, like now visually we're starting to see like not tracking a toy or things like that?
Yeah, and so you can see it at a super early age actually. If your child's like 3-4 months old and they can't track an object, right to left, or you're noticing, oh, they'll track it to the right and then the left, they kind of stop here. That's like a huge red flag. Or as kids get a little bit older, they should be able to, we call it like isolate their eye from their head movement. So they should be able to just move their eyes in isolation. So if you see your kid just always turning their body every time they're looking for something, that's a huge red flag, and intervention would be necessary for that as well. And that affects so many motor skills.
And these are all things like we just don't think of, you know what I mean? Like until I guess you saw a child do that, it's like, yep, that shouldn't be happening.
Yeah. You'll see a child, like they just turn their whole body and they kind of scoot in a circle to look for things. And they could just have tight neck muscles. They could have trouble moving their eyes. They could have,
and that's where you step in to kind of be the detective as far as like, why are they doing this? Because it could be so many different things. Like you said, it could be the eyes, it could be the neck, it could be anything. And
it could be
where you kind of do your evaluation to figure it out and then give the support to the parents. I think which is huge is like you're not just supporting the child, you're supporting the parents to give everybody a better life, so that you're not having these explosive tantrums and not knowing why they're happening.
Yes, correct. So
you can kind of get there and be like, it's coming and I know how to fix this.
Exactly. And I think that's another key. If your child is in intervention, especially if they are getting sensory integration therapy, whatever, I would strongly encourage you to make sure your therapist is educating you, because with sensory, this is my biggest pet peeve, is I will have people come to me and say, okay, I used to drop my child off, just drop them off, they'd see them, and then they would be good for like an hour or two after. And I'm like, well, what? And then they would have meltdowns the rest of the week. So a big piece of the sensory processing stuff is intervention is great, but intervention is needed throughout the day and constant and repetitive to make a change. Okay, so our brains if we do something once a week for an hour and that's all you do it, you're probably not going to see a lot of change, right? And so same thing with sensory stuff. If you don't understand your child and your therapist isn't educating you on why your kid's doing what they're doing, or here's a technique that helps them and they need to do this throughout the day, they're probably not going to get better and you're not going to see a lot of changes. And so that piece is so crucial. And sensory is so confusing because every child will present differently. Some have sensitivities, some have an over need for sensory input. Some kids are under registering. So we have these kids that are coming and really like always tired, really low tone. I just had a child who, this is a good example of that, is he came in and he had zero clue where he was in space and just appeared really weak. And we put him on a swing, and he has a lot of vision stuff too. We put him on a swing, and even holding on, he couldn't, like, even the minute you move the swing, he was just like falling over. And he was 5 years old. And you're like, wow, how is this child still? But he could walk. You watch him walk. And so we did some more sensory interventions actually, and gave him lots of input and lots of stimulation, and, you know, within like 3 sessions, he could now sit on a swing and swing without holding on to anything, because he knows where he is in space now, and he's using his eyes better.
Wow.
So there's, you know, there's so much complexity to sensory stuff. So if you just say, yeah, my kid's getting sensory integration therapy once a week, you're not going to see a change, and you need to kind of ask your therapist, what can I do at home? And you need to kind of be dedicated to implementing that at home as well.
Yeah,
and
if
you'll
your
see
therapist is not giving you homework, it's just like, I think of it as kind of like working out. If you're not working out, you're not going to see the benefits of doing it. So you should be doing your homework in order to see the benefits of even going. Like, why go if you're going to go once a week and not, you know, do the homework?
For sure. Yeah.
Right.
And I always tell parents, you have this brain that is growing and developing. So if your child's getting into intervention at like 1, 2 years old, how amazing, because they're making so many connections and so much quicker than you would see like a 60-year-old, right? And we see it all the time with kids that have strokes and those types of things, like, or they have part of their brain removed, and we can see like, wow, like, look at, they should not be doing this. You know, if you look at all that stuff, but that neuroplasticity and that constant repetitive motor action or intervention that's actually rewiring that brain is kind of what we're going for, right? So with the sensory system, I always say, if we're trying to get the child used to this stimulus, you want to do it over and over and over again, so they get used to it and they learn their coping skills, and their brain's processing it now, right?
Right.
So once a week,
in a happy way. You're not just like old school, just do it.
Yeah, exactly.
You're finding a way that they like it and they enjoy it, so then they just do it naturally.
Yeah, exactly. So
amazing.
Yeah.
Well, if anybody else has questions or comments, please drop them below. Jenny's happy to answer. And if you think of anything later, guys, you can always DM us and we'll make sure we send that message over to Jenny. And we're going to post this on our page, so please comment on it. And we'll make sure that Jenny gets all of the questions and comments.
Yes.
But is there anything else you'd like to touch on? This was incredibly informative. I cannot thank you enough for joining us. I
mean, I could talk forever about all this. So, there's so much to it, but I think the biggest thing is, like, I think as a parent, we kind of, sometimes you just have that intuition. There's something just a little off with my child.
Right.
Never feel like you're doing a disservice by just saying, oh, I don't want to, like, go in and I'm almost embarrassed to ask the doctor, or if the doctor even pushes it off on you. Oh, they'll be fine. They'll be fine. You as a parent, I would push for it, like, advocate for your child as much as you can. I have 2 children and they both needed speech, right? And I knew they needed speech at an early age. And a lot of times the doctors would say, oh, they're fine. They'll be fine. And it's like, no, there's something else going on here. And I know how, important that early intervention is. So I think just keep pushing, advocating for it, because it doesn't hurt. And even if you just go to evaluation and they're like, no, I think your child's doing great, at least you have that validation that, okay, they are good. Or they might say, yeah, they're a little bit behind on this. They might give you a few ideas. Or, hey, like, sometimes I'll say, they're a little on that fence. Here's a couple things to do. And then 6 months from now, let's do a reevaluation and see if they're progressing.
And give you peace of mind as well as, like, a parent, to not have that anxiety and worry, like, is this okay? Are they okay? Is this not, like, just go. If you're ever questioning, I swear parent intuition trumps everything, in my opinion. As, like, a mom who's been through it, like, every time I felt something, sure enough, and pediatricians have always been like, oh, it's fine, or this or that, and I've always just been like, and push further, and sure enough, when I finally get to the expert like yourself, like, yep, there it is, or whatever the case may be. So if you feel it, definitely just go get it checked out.
Great.
Yeah. So. And I love the fact that you say that, therapists make sure they're giving you homework, because just like anything else, you want to make sure that your therapist fits you and your child, and you're getting homework and you're seeing big strides. Would you say, like, on a weekly basis?
I think it just depends on, I think if you're getting good intervention that's higher intensity, you should see some improvement in a week. Some of the sensory stuff kids have already sensory is hard because some kids do develop behaviors, and it's sometimes it takes a few weeks to kind of be consistent with the sensory stuff where you're seeing a little bit of improvement, but the behavior might still be there. And so sometimes it's just finding that balance of behavioral management and sensory. But I mean, you should see some improvement. You know, I think majority of the kids I work with, you do. I think it's
Right.
the lack of, if there's no carryover at home, then yeah, sometimes we're like,
Right.
well, they did great in the session, but because a lot of times in our hour session, you can see an improvement, and you can, by the end of the session, or you can see different things, how they affected the child. They're more regulated now, or they just appear calm. They're you know, kind of engaging, and they're kind of exploring the world a little bit more. But if there's no carryover, you're probably not going to see as much improvement. So
Right. So if you're all in and you're doing everything and you're going to therapy and you're not seeing improvement, might be time to check somebody else out.
yes, for sure.
Yeah. Yeah. Well, thank you so much for joining us. This was
Yes.
incredible. And again, we'll be posting this, so please drop a comment and we'll make sure that Jenny gets it. And you can go ahead and go follow her. And her username is going to be in the post as well. But
Yeah.
that's it.
And feel free to, you can message me on different stuff too, or you just kind of have questions on just even different resources, or where would I go for this? Because there are different centers depending on what your child's needs are. So I work in a medically based center. I work with all sorts of diagnoses. But, you know, like a lot of times you don't want to, if your child has brain injury, going to like a sensory center, you know. So
Right.
If you just need kind of shoot some ideas, or, hey, we're doing this with our therapist, do you have any other ideas? I'm more than, you know, happy to answer any of your questions.
That's so kind. Thank you
Yeah.
so much. Yeah. Awesome. Well,
Yeah.
you have a good evening, and thank
Yeah,
you.
you too. Well, thank you.
All right. Take care.
All right. Bye.